I am Dr. M S Reddy. I'm a psychiatrist practicing in Hyderabad, India. I've been having a special interest in mood disorders, specifically bipolar, but in general, mood disorders for the last, I've been practicing for the last 4 decades. The last 2 decades, I have my special interest in mood disorders, especially the depression and major depressive disorders, and then how do we manage that, and then what is the morbidity, how best we can treat a patient with depressive disorder. That has been kind of my passion in the last 2 decades. As you all know, depression, sadness, depressive disorder. Depressive disorder is something much more than sadness and depression. I'm a businessman. Let's see that. I'm a businessman. I had a bit of a loss in my business. Everybody knows the COVID pandemic and then the last few months. I had a loss in my business. I feel sad and I'm depressed. This is normal sadness. I had depressive disorder. I don't know why I had it, but I had a depressive disorder. Because I had depressive disorder, I was not able to focus. I was not able to concentrate, plan, and execute whatever the things I'm supposed to be doing in my business. I suffered losses. This is depressive disorder. On the face of it, both look almost similar, but there's a huge difference between these two. 5% of population on this planet Earth, I'm talking about the lowest figures, 5% of the population suffer from depressive disorder. And the sad thing is, more than 40% of cases, it is less than 20 years is the age of onset. Imagine an youngster, a teenager, an adolescent suffering from depression. His education, his plans for the future, marriage, and then job, and the whole lot of things get disturbed. And this is the time, because of depression, there's a high risk of self-medication with substance abuse. 5% of the population, and less than below the age of 20 years, half the persons getting their first attack. The general population, I said 5%. If one of your parents had depression, the risk goes up to 10 to 15%. If you're a twin and your other twin has got a depressive disorder, your risk is 50%. This tells me there's a significant heritability, genetic risk for the development of depressive disorder, which I think we all have to understand. I don't discount psychosocial factors, but they play definitely a secondary role in majority of the cases. It's twice more common in women. Menopausal, postpartum depressions are one of the very severe things. And also what we call as a premenstrual depressive disorder, which occurs during the period of menstruation. It's what I call as a miniature version of major depressive disorder. So 5% of the population, 50% occurring below the age of 20, twice more common in women. This is what the scenario of depression. And all of us know what are the symptoms of depression, but I want to highlight two specific features. One is diurnal variation. Patients with the depressive disorder, significant group of them, they feel miserable in the mornings, but by evening they become much better. This is something which is unexplained. The internal neurochemical circadian rhythm balance related. Second is that they wake up early in the morning, 2 o'clock, 1 o'clock, 3 o'clock, and they feel miserable after that. These are the two cardinal features of depression. Depression is treatable. Depressive disorder occurs in episodes. Depression is treatable, episode is curable, treatment is reasonably simple. After saying all this in the same breath, I also say that World Health Organization has declared that more than 50% of people with depressive disorder, patient depressive disorder, do not get adequate treatment for obvious reasons. One other thing being lack of awareness. This is why I quite frequently keep saying that I, Dr. M S Reddy Psychiatrist, I am depressed about depression because it's not being treated. And as I told that, occurring below the age of 20, suicidal risk is 15%. This is some of the major morbidity, disability with depressive disorder. What is it due to? One is that heritage, heritability, like genetics. Second thing is neurochemical disturbances in the brain, especially the serotonergic system disturbances is one of the supposed to be one of the major reasons. How do we treat? Medicines. We have excellent medicines right now, what we call as SSRIs. I think most of you know Prozac, the legendary drug which has come and it's not like it was there for almost 2-3 decades. Same group of drugs, SSRIs. Majority of the patients, they do well. Patients almost recover symptomatically, but people have tremendous kind of misconceptions about these drugs, about so much of nothing about the side effects and all. I tell you, SSRIs are one of the safe drugs. Yes, drugs have side effects. There's no drug or there's nothing in this world without side effects. They have a minor side effects, no long-term side effects. You can give the drug for a very long time. SSRIs are effective, but patients should have awareness about it. We need to talk about depression. We need to create awareness about depression. We need to treat it properly. Start the patient on that. Usually the treatment lasts for about a few months. The most important thing is the treatment. The drugs start acting after about 3-4 weeks, so we need to wait. So these are the gist of the things. Depressive disorder is something more than simple sadness. To a large extent, it is genetically mediated and neurochemical disturbances in brain. 5% of the population are affected. Depression treatment is simple. SSRIs are effective drugs. Psychosocial counseling definitely helps, but somewhere it's not being done. And that's exactly the reason we have to create more awareness about this particular illness called depressive disorder. That's the most important thing today. And that's exactly the reason these few words I'm talking to you, because it creates so much of morbidity. We need to do something, that each and every patient who is affected with depressive disorder must get a proper treatment and should recover, get back into the society. With societal reintegration is going to be the most important thing. Thank you very much.